and good day. My name is Angela Harris.
And my name is Akila Corbett.
And today we're going to be discussing our case example, which deals with person-centered therapy.
And first, we will be explaining our case example. Our patient name is Helga. She was born in Germany. Now she lives in New Jersey. She has spent some time in a mental institution and has no intimate relationships and feels a deep sense of rejection. PCT is used for people that suffer from anxiety, stress, low self-esteem, interpersonal relationship problems, unhappiness in work or home, and have suffered from being physically or sexually abused. History about PCT. It was created by Carl Rogers in the 1940s. It's led by the client, and the clients are the ones that are responsible for their future, and they're the ones that come up with the solutions to their problems. They also have control over what they would like to discuss in the sessions and when they would like to start and stop therapy. Person-centered therapy emphasizes on self-actualization, and it is important to realize that in order for you to go up the triangle, you must first conquer the prior levels, and the goal is self-actualization. Once the client reaches self-actualization, they are more open to experiences, they're able to evaluate themselves internally, and they are willing to continue to grow.
The therapist's function and role. PCT use themselves as an instrument of change. The therapist is also a catalyst for change, and the therapist must be willing to be real in a relationship with client by being congruent, accepting, and empathetic.
3 characteristics must be presented in the therapist in order for the therapeutic process to be effective. First one is congruence, which means that the therapist must be 100% genuine. Secondly, unconditional positive regard. The therapist must be accepting to the clients and that the clients have their own thoughts, beliefs, and feelings, and they do not need the therapist's approval. And lastly, an empathetic understanding. Empathy is a deep subjective understanding of the client and should not be mistaken with sympathy.
The relationship between the therapist and client. As clients experience the therapist listening in an accepting way to them, they gradually learn how to listen acceptingly to themselves. As clients find the therapist caring for and valuing them, they begin to see worth and value in themselves as well. As clients experience the realness of the therapist, they drop many of their pretenses and are real with both themselves and the therapist's quality of the therapeutic relationship. And lastly, it is very important to ask mirroring questions. They are questions that are intended to encourage another person to continue to add detail to what they have said without influencing the person to go to a specific direction in terms of content. Some therapeutic goals are aims towards the client achieving a greater degree of independence and integration. Focus is on the person, not on the person presenting problem, and it assists clients in their growth process so clients can better cope with problems as they identify with them. Clients' experience in therapy. They can express their fears, anxiety, guilt, shame, hatred, anger, and other emotions. With therapy, clients distort less and move to a greater acceptance and integration of conflicting and confusing feelings. Individuals in therapy come to appreciate themselves more as they are, and their behavior shows more flexibility and creativity. And lastly, they become less concerned about meeting others' expectations and thus begin to behave in ways that are truer to themselves.
Hello.
Hello, Helga. I'm Dr. Harris, and I will be your therapist for today.
Nice meeting you.
Likewise. Okay, so whenever you're ready to talk, I am ready to listen.
Well, I'm feeling very depressed, a little stressed out. I feel as though it's hard for me to kind of talk about it.
So you've been very depressed and stressed out.
Yeah, I dread getting up in the morning, and I feel like everything I do is a failure. I couldn't keep a husband, I lost my kids, and I feel like everything around me is just falling down, and then I blame myself for it, and I feel guilty.
Okay, I can see that was a bit hard for you to say, being that you just met me, but I'm very proud of you for opening up like that. And you are entitled to feel the way that you are feeling. So what you're saying is you feel worthless and nothing positive is happening in your life?
Yes, I guess it all started like when I first met my husband. He used to abuse me verbally and physically, and he used to make me feel like nobody was, like I wasn't worth having anybody, like he was the best I was ever gonna get. And when I had my first child, he like what happened? Okay, yeah, so when I had my first child, like, you know, it was okay or whatever, but then I lost my job. So he was the person that was making money, and he used to make me feel worthless because he was the one that was making the money, and I would just stay home with the child. And when I was having my second child, I was diagnosed with postpartum depression. And it's hard for me to say this, but I committed suicide. I tried to commit suicide while my daughter was lying on the floor next to me, and my husband found me unconscious. And since then, like, he put me in a mental institution, like he filed for divorce and filed for full custody of my children. And that's been like 3 years ago, and I haven't seen them since.
Okay, I'm so sorry to hear about your children. I can only imagine the pain that you've felt and been through. So you've tried to commit suicide and you were in a mental institution?
Yes, I think since the time I committed suicide, probably did like 3 more times. And I actually spent 2 years in the mental institution. And I came out, and my therapist told me that therapy would be good for me, so that's why I'm here trying it now.
Okay. So do you feel as though therapy is helping you?
Yeah, I mean, I guess it's okay, but like I still have feelings of worthlessness, like even like I feel like I'm missing something, and those are my kids. Like, you know, like when I was even like, I haven't had any relationships with anybody because I feel like people would just kind of ignore me. And doctor, all I want is to feel loved, and I've never felt that way since I left Germany, and like and since I was here, like I felt like I was missing something, and I've always wanted to go back to Germany, but I never, like, what's the point, because I have no family there.
Okay, Helga, well, I want you to understand that it is not any of your fault why this has happened to you. I want you to know that you are a loving mom and you were a very good wife. So what I'm understanding is you want a relationship with others, but are having some issues with that.
Yes. I just feel so worthless and rotten and full of guilt. And every time I try to communicate with somebody, like, I feel as though people just walk right by me. And I feel like I don't exist to people. Like, and especially with like my husband, well, my ex-husband, like he wouldn't even let me see the kids, and I just feel like I don't even exist to my children. I don't exist to them.
Okay, so what I'm understanding is that you feel as though you may be invisible to people in general?
Yes, and no matter what I do or try, like I just can't see the light out of this long, dark, scary tunnel that I'm in.
You feel as though you're in a dark tunnel?
Yes. Like, I feel like my future is like that, actually.
Okay. So you just want to be the happy girl you once were when you were in Germany?
Yes, I long for that. Like, when I lived in Germany, I lived with my parents, and my parents actually like sent me away to go live with their friend in the United States. When I left, somebody told me that the house that my parents lived in, it was burnt down, and my parents and my family, like my parents and my brother, they both died. So I eventually left the house that I was at, like living with my parents' friend, because I felt like I can search for them, and even though I knew within myself like they were gone, like I just wanted that feeling back. So that's why I left, and it's just been down the hill from there.
Okay, so you were devastated by the tragedy that happened to your parents in Germany, so then you ran away from the family you were staying with in the U.S.
Yes, I just felt like I wanted to look for them, and I don't know what reason like made me leave and think that like they were still alive, even though I knew within myself like they were gone.
So the younger you felt empty and was looking for your parents, although you know that they were already dead.
Yes, I just want to feel the way that I did before.
Okay, Helga. Well, our therapy session has unfortunately come to an end, but I do appreciate your time and honesty during this session. I understand how hard it has been for you to open up and let loose to me, being that we just met. but I am extremely proud of you for doing so. I know that all you've been through has not been an easy journey, but today is a fresh start for you, a new beginning, to something of new timing. To put away your past and not worry about what others have to say or think, but rather live for Helga, live for yourself. So, as our session has come to an end, I now challenge you, Helga, to do just that, to dig deep within yourself, and just live for Helga and not for others.
Thank you, Dr. Harris.
Anytime.